things that were the same, but there are a lot of differences. The things that were the same is something that we continue to say, that epidemics and pandemics occur. They have always occurred, even before recorded history. When history began recording them, they occurred. They're occurring now, and they will continue to occur. So we had, in the relatively short period of time, we've had two of the most impactful pandemics in the history of civilization. When you look at, the bubonic plague, the 1918 pandemic, and all of that, the HIV pandemic and the COVID pandemic really ranked high among them, and they only occurred literally in the last 45 years. I think the similarity ends a bit there, because if you look back at the early years, and I was alluding to that very briefly in my brief opening comments, it was a rather insidious evolution of something going on that was really bad that we didn't understand. Remember, the first patient I saw in 1981, we didn't have a name and we didn't have an etiology. The etiology was discovered in 1983 and proven in 1984. The name AIDS only came in September of 1982, a year and 3 months later. So over a period of time, we were learning the extraordinary impact of this. And I remember the first time we had a diagnostic test in 1985, and we did serosurveillance in Greenwich Village in the Castro district. I think that was one of the saddest days of my professional career, when we found out that 50% or more of the people who were tested, who were almost exclusively young gay men, were HIV positive. So the enormity of that did not really occur to us until years into it. That's different with COVID, which was an explosive outbreak that involved everybody and anybody, not only in the United States, but throughout the world. So it wasn't that evolving process. The other comparison and contrast that I think is important is the role and the impact of the investment in basic and clinical biomedical research, which had an enormous impact on both diseases, but in a very different way. If you look at the work that was done with HIV treatment, starting with the first drug in 1986, approved by the FDA in 1987, AZT. 2 years later, we didn't have the second drug, DDI and DDC, and only in 1996 did we get the triple combination, which was anchored by the protease inhibitors. Fast forward to the 21st century, and now we have drugs that's one pill, once a day, completely suppressing the viral load. Yet, we don't have, yet despite the elegant science, we don't have a vaccine yet for HIV. In contrast, if you look at COVID, we had a vaccine in the unbelievable time frame of 11 months from the time that the actual pathogen was identified. And yet, even though we have some good therapies, we don't have that profound capability of completely blocking this virus. And when people come into the hospital, as we all experience, myself included, so many people died, 1.2 million people in the United States in a period of a couple of years. So again, there are similarities. The similarities with the enormous investment in basic and clinical biomedical research, and how it differently expressed itself in the arena of vaccines versus drugs. So I'll stop there. I can go on and on, but I think we have to